It's one of those that's been in the shadows, and hopefully this will shine a bright light on it, and it will raise the level of awareness and get people the help that they really need.
In our State of Addiction coverage, a new state-of-the-art addiction and mental illness treatment center coming to Edmond. The Integris Arcadia Trails Center for Addiction and Recovery will open in early 2019. We are joined now by Bruce Lawrence, President and CEO of Integris. Why this treatment center? Why now?
Well, the need has been here for a long time, and there were a group of individuals that got together about 6 years ago. Kelly Dyer, Fry, Murali Krishna, Reggie Whitten, and Commissioner of Mental Health, Terry White. And they started talking about the need, and there was nothing in Oklahoma like this. And then they brought me into the conversation, and we took a look at it, and we agreed that Integris had a role to play. And so that's why we stepped forward.
And you say nothing like this in our state. What makes it so unique?
Well, I think the thing that makes this one unique is it's going to be an addiction treatment center that also focuses on mental health and trauma. And research shows that most people that have an addictive disease also have underlying mental health issues, and many of them face trauma at some point in their life as well.
Talk about the addiction crisis in our state specifically. We know that this is the #1 cause of unintended death for folks between the ages of 25 and 64,
Correct.
Yet we are ranked the worst at taking care of those folks. What's going on?
Well, I think not a lot's going on, and that's why now's the time to step forward and do something. The other thing about this center is it's going to be placed on our Integris Edmond campus, and to have it be a part of a full-service hospital campus also brings to the awareness that this is a brain disease. This is not something that's just caused by someone's actions. They are impacted because their brain is reacting in a way that they need help, and so it's a medical condition.
Talk about how the facility will work. Inpatient, outpatient, both? It's
a combination. There will be 40 beds on the campus. And then there will be a very extensive outpatient treatment program. The length of time typically will be 45 to 90 days on an inpatient, and then up to a year on outpatient treatment.
How will people be admitted? Is this self-pay, insurance, a combination of both? How does this work?
So the patient will be responsible for the payment. We will work with them if they have insurance coverage to help them file the appropriate paperwork so that they can be reimbursed. But centers like this around the country are all set up in this similar way.
What will make this treatment center different? You say you will be different, but what will make it different and make people, stay here in Oklahoma? A lot of times when we hear about people doing residential treatment, people sometimes travel out west or different parts of our country. What would make people stay here in Oklahoma?
Well, we'll have a treatment center here that will rival those in other parts of the country. That's our desire. We want to be a world-class center. And then you combine the addiction with the mental health and with the trauma and the specialists that we will have surrounding the patient and the family, because this is a family journey as well as a patient's journey. It creates a compelling opportunity to stay in Oklahoma.
And you touched on just briefly, but why Edmond and why not another campus?
Well, the total environment is so important to recovery, and our campus in Edmond is in a beautiful setting. This center will be able to be built on the east side of that campus in a wooded area, so it'll be very tranquil, and that will just aid in the overall recovery process.
Talk about the staff and how you ensure you get the best staff. I imagine these are vacancies that will be filled closer to the date, but how do you ensure you have the best staff there working?
Well, first we'll start with the physicians, and we will be doing a national search, and we're looking for the top talent that's in the country today, and then we'll build a support team around them because our intent all along is to be a world-class treatment facility, and you have to have that staff to do that.
What about in the meantime, between now and 2019, how is Integris helping in this statewide issue?
Well, I think just the publicity that it's getting right now, people are talking about it, and we're trying to get the word out there to address this is an issue in our state. As you mentioned, this is the leading cause of death for those between the age of 25 and 64. We've got to do something. We can't continue to ignore it.